What's up, everybody? Welcome back to my channel, Nurse Netta. In this video, it's similar to the video I posted before about my work routine, but this is an updated routine for me. With everything going on with the COVID-19 pandemic, things have changed drastically for me in the ER. I transitioned from being extremely busy, working at a really fast pace to things dramatically changing. Um, so, um, it is the exact opposite of what I was expecting when this virus hit the US. Based off what I've been seeing on the news, what I've been seeing on social media, what's been happening on the East Coast, I was like, okay, just trying to mentally prepare myself for the rush and the, pandemic to like hit hard. But for me, honestly, it did not hit as hard at my hospital. It's been the exact opposite. We've had a drastic change and a decrease in the amount of patients we've seen. A normal typical day in our emergency department, we see anywhere from 160 to 230 patients a day in the ER, and that's drastically changed. Um, the first week that the stay at home order was issued in California, people completely stopped coming to the ER. The only people we were getting were very few. Like, we were getting very few patients to what we were used to originally. So we went from seeing about 230 patients in a day to 110 if we were lucky. So yeah, it's just been really slow at work. Our census has been low for the past 7 to 8 weeks. So usually I see the lower acuity patients who are less critical. Now things have changed. So instead of working the fast track area, we completely shut down the fast track area. So we no longer have that area open. We're only utilizing our 3 pods. They completely transformed pod 1 into a respiratory pod. So all of the patients who are having any symptoms of respiratory issues, whether it's bronchitis, pneumonia, cough, shortness of breath, anything COVID symptoms, we send them to pod 1. So as an LVN, I don't have direct contact with people who are suspected to be or positive for COVID-19. They send the RNs and specific providers and doctors to deal with those patients. So I no longer see respiratory patients, whereas when I first started working in the hospital, my first couple weeks I was testing and treating so many patients with influenza, left and right, and it was crazy. But now I'm not dealing with hardly any respiratory patients at all. So pod 1 is shut down, strictly isolation for respiratory. We call it our COVID pod. And so we only have 2 pods operating and no fast track area. So our census has been low. And lately I've been the screening nurse. So they have me up front. So when you come into our department, there's 2 sets of double doors. There are the double doors that are outside, and there's like this little area, and then there's the second set of double doors that leads into the lobby. So they have me and a security guard set up with our computers and our chairs in that little space between the outside and the inside of the department, and I screen everyone who comes to the ER. So for 12 hours, I'm screening people. I have my thermometer, and I have my O2 sat monitor, and I'm checking temperatures, and I'm checking people's oxygen levels. So I have pretty much like a script that I say to every person who comes up. So I ask people when they come up, are you having any cough, fever, shortness of breath, or have you been exposed to anyone who's tested positive for COVID-19? If they say no to everything, I check their temperature, make sure they don't have a fever, check their oxygen level, and depending on their answers to the questions, we have a drive up area with our tents that we send patients to if they're stable. So if they're not in any distress, if they're not in a critical situation, maybe they've just been having a cough, or maybe they're a little short of breath, but their oxygen level is okay, we send them to the drive up area and they have a designated COVID nurse and a provider to see them in their car. So they want you to stay in the car. If you have any of the symptoms, either cough, fever, or shortness of breath, or known exposure to COVID-19, if they don't already have a mask on, we give them a mask, tell them to drive around our ambulance area and park their car, and the doctor and the nurse sees them from the car, because to um, they want exposure to be, at a low. So they want to limit the exposure to possible COVID-19 patients. Um, Now, on the opposite, if they're having symptoms but they're in any type of distress, so if their temperature is really high, maybe at like 103 or 104, or they have shortness of breath and their oxygen level is low, we don't send them to the drive up area. We send them to directly to Pod 1, the COVID unit, and we treat them there. Now, if you don't have any symptoms, maybe you're just coming in because your high blood pressure is, a little out of control and medication's not working, or you got bit by a dog, something like that, we still screen you, check your temperature, and if you're okay to go in, we let them go in. So that's what I do for 12 hours. um, which is cool. It's not bad, but it does get slow and it does get boring, and oh my god, sometimes I'm just like, time is dragging, but it's all right. Also, because our census has been really low in the department and in the hospital overall, they've been downsizing, so they've been sending a lot of nurses home early. They've been um, canceling us, like telling us not to come in because they have to downsize. Now, we're still getting paid. We still get our PTO. We have to use our PTO to, make up for the hours that we're losing. But it's working. We haven't lost our jobs. We're still blessed to be employed, and we're just pretty much going through the motions of this change right now. And it's been, like I said, about 7 to 8 weeks that it's been like this. It's slowly starting to pick up. In the last 2 weeks, I've noticed it's picking up, but it's still not where we once were. But overall, my experience with this pandemic that's going on has not been crazy. We do, you know, kind of go with the flow of what's going on because it's so unpredictable and we don't know what to expect. Um, we do wear our N95 masks. They have told us not to wear the cloth masks in the hospital because cross-contamination issues. They want us to wear either a surgical mask or an N95 mask. And I personally hate wearing the N95 mask because it is compressed so tight on my face that it breaks down here, like on the bridge of my nose and right here. So just imagine wearing this tight mask for 12 hours, and by the time I take it off, I'm like red right here, and it's just my skin gets irritated. They tell us not to wear any makeup, so the men have to shave their beards, and the women cannot wear makeup because they don't want, to get the mask dirty or whatever. But we have not experienced any shortages in our PPE at all, which is a blessing because I know a lot of hospitals don't have what they need to care for these COVID patients. We do have patients who have tested positive for COVID. We have patients who have recovered. We've had patients who, have passed away. I don't know exactly what the numbers are, but I know that we are not being hit as hard as a lot of hospitals in the East Coast. How how they've been hit. It hasn't been that bad. So yeah, I'm very grateful for that. So that is an update on my work routine during this coronavirus COVID-19 pandemic. Things are a lot different, and I'm just hoping that eventually things do go back to normal. Um, I'm just being patient and appreciative that I'm still employed. I'm very lucky to have my job, and I'm very grateful to have my job, and we're all working as a team. We're all strong as a unit, and we're just hoping that things do get better. I do want to send my condolences to people who have lost loved ones or lost their lives to this COVID virus. It is absolutely devastating. It is real. It's horrible. Um, but I'm just sending lots of love and prayers and strength to people, anyone who's been affected by it. And until my next video, bye guys.